As of April 15th, we've experienced 211 cases of the coronavirus in Bossier Parish, and we unfortunately had 11 deaths during that period. The purpose of this briefing is just to update our citizens of Bossier City and Bossier Parish on what we have been doing and will continue to do. First of all, city business, we're continuing business as usual for the most part, but consistent with federal, state, the Center for Disease Control, Homeland Security, and other agencies, makes sure we are in compliance with the guidance that's been provided. Most of our non-essential employees, well, all our non-essential employees are not working, but they are working out of their homes via telephone and teleconferencing, and as required. Our police and fire departments, for obvious reasons, remain essentially at full staff with very few people that are not essential at home. You can contact any city department if you have information, and you can also go to our link, Bossier City link, which is bossiercity.org. As I mentioned, the police and fire department are basically at full staff and are doing us a great job, as they always do. Our police department has been very involved in helping educate businesses and the citizens in what the directives require of all of us, and monitoring to see that those requirements are being met. In EMS calls, fortunately, we have not experienced the quantity that we thought we might get, and that's a good thing. But Chief Zagone and his department has been very proactive in acquiring the resources that we will need, and even more so, perhaps, if this does not get resolved as expected in some circles, to have plenty of supplies on hand to take care of our people, our first responders, our medical teams, and so on. So we're doing a lot, and we're doing, as we mentioned in our last briefing, we have this capability to sanitize our ambulances and our fire stations so that when we do have to transport people, they're doing it in a safe manner that doesn't exacerbate the problem. We are continuing to coordinate with our parish officials, elected officials, the military, medical people, Homeland Security, and many, many others to make certain that we're all on the same page and complying with the directives and guidance that's been provided to us from the federal, the state, and from these other agencies. Our current focus, or rather the current focus and the subject of a lot of discussions right now in the media, is how and when are we going to return to some sense of normalcy in our economy. That is going to be a very hot topic, obviously, but we're not there yet, and it appears that this end of April may be a little ambitious, but we'll have to see what is put forth by the scientists and medical experts that are advising the presidents and the governors and these other agencies. But every one of us must do our part. We will not contain this virus unless we all do our part. So I urge you to continue doing what you're doing and make certain that those you can influence are also complying with all these directives if we're going to stop the spread of this virus. It's just imperative that we comply with the guidance that's been provided to us. That said, I'm going to ask our two chiefs to make some comments. So we'll start with you, Chief Zagone.
Thank you, Mayor. First off, I'd like to say thank you to the men and women of the Bossier City Fire Department and the first responders, police, fire, and also the healthcare providers out there that are in the middle of all this. And I know I can speak for the fire department that they're doing an excellent job.
They are.
I want to say this, that we look different and we act different on our EMS calls than we normally do. You'll see they're going to have the goggles, an N95 mask, gloves, and they're going to ask you when they get to the door, they're going to ask you a bunch of questions. Say you're having chest pain or slip and fall, standard call. They're going to ask you questions in dispatch that will preempt to find out if you could possibly have symptoms or a corona patient. they're going to ask you to come to the door and come outside and ask you to put a mask on. And then if we see you have symptoms or we see that you are a positive corona patient, you'll see the ambulance crew that comes in will have a Tyvek suit on. After that, we will dispose of all these items if it was a positive or a potential positive corona patient. We're going to still take care of the citizens and guests of this city just like we always have. We're just doing it in a little different manner now. Looking at the stats over, I can tell you the last 14 days, we've made 373 calls. That's all calls, Rex, fires, EMS calls. 199 of those calls we've transported to the hospital. 38 of those were COVID-19 patients or had symptoms of COVID-19. Of the 38, we know 12 were positive. That's our stats for the last 14 days that we're keeping up with, just to let you kind of have an idea of what's going on out there. Every call, though, we will have the mask, the glasses, and the gloves at least on. Looking at it, you've heard a lot about the Plaquenil, and so we looked at the stats and the cardiac dysrhythmias that could possibly be caused by that. So we used to have mag sulfate. It was hard to get. Now we've obtained 25 more vials, and we had about 40. So we put a cardiac dysrhythmia protocol back together for torsades de pointe. That is the dysrhythmia, but that possibly could be associated with somebody if they took that and then had a rare cardiac event because of that. So we have thought ahead to put in place what we need to put in place to take care of that patient also. Looking at the reopening deal, we've talked with the mayor yesterday and looking at what it possibly could look like, because in Corona time, it's a day seems like a week. The things you're trying to think ahead of trying to figure out. So we're building maintenance to putting a locking mechanism on the doors if that is needed at City Hall, to where we can do a temp check and prior to you coming in City Hall during the reopening, and we're going to be further into that. We just want to be ahead of the game as to this can be there and it wouldn't interrupt anything if we went back, day-to-day operations. You cannot use it. We don't want it to interrupt anything, but in the meantime, if that's something we need to do, we want to be ahead of the curve and not behind the curve, trying to be ready for that. We did order thermometers at the beginning of this, and I just placed another big order for thermometers. So we're ahead of the game as far as all departments being able to be taken care of. If we need to do temp checks, we're just trying to think ahead, talking with the mayor as to what we need to be doing in preparation for a possible reopen. I also want to thank the administration and City Council for their forward thinking on the UPL money when they made a capital contingency fund 5 or 6, 7 years ago, when the upper payment limit Medicare, Medicaid money from our ambulance transports, they put into a capital account. So those funds were available for us to get ahead of the curve and start ordering the PPE needed and the thermometers and all the other things needed to combat this pandemic. And the only other thing I'll tell you, when our guys come to work, and so you understand that what we do, as soon as they come to work, they get a temp check twice a shift, that evening and the next morning. Then they answer questions. Have they had symptoms? Have they had any unprotected exposure? Have they had a COVID positive test? Are they waiting results? Or is a family member positive or possible waiting results? Those are the questions. They answer yes to any question, or their temp is above 100 on the forehead check. Then at that point we will put them off, and luckily at this point we haven't had any. We haven't had any that we've had a couple get tested. We haven't had a positive yet, knock on wood, and hopefully, prayerfully, that stays the same. We did receive yesterday, we jumped early out in the order and from a company that we bought test kits after 9/11 for anthrax. And we did get a delivery yesterday of an antibody kit. And so we're gonna test these on somebody that's a known COVID person and see how the results come out and see how they work. And then we're gonna make these available to the firefighters to check themselves, and it's just a kind of FYI deal for them. So thank you very much.
Thank you, Chief. The city is very fortunate to have had the foresight through our fire department and the EMS services to prepare for contingencies like this. We had a lesson learned, I guess, during and after the Ebola situation, Chief.
Yes, sir. We after Ebola, we prepared a whole lot from whenever Ebola was 5 or 6 years ago. That being in Dallas, 2.5 hours away, and was very scary and eye-opening. And I think we learned from it, and I can honestly say we started off in very good shape. And since then, we've become in better shape for as far as PPE, supplies, what to do, how to treat it, how to decon it. And so, thank you for helping us with that.
Well, as we all are hoping and praying that we are returning to some sense of normalcy, but I think most people would agree that it's going to be a new normal. It's not going to be like, it'll never be like the old days, and for months, perhaps years to come, we're going to be dealing with this pandemic in one way or the other. As we announced last week, the city does not have a curfew in place, nor do we have any plan. And Chief, I just see what, if you've seen any indications that we need to reconsider that for any reason.
No, sir, not this time.
Anything else you'd like to share with us?
Yes, sir. As the mayor and Chief Zagone both said, I'd like to echo our appreciation for our first responder and our medical community that are on the front line of this. As far as the police department goes, we're also changing up some of the ways that we handle and respond to our calls. We also have a questionnaire that normally wouldn't be asked, but under these circumstances, there's going to be questions that I ask, like Chief Zagone said, such as temp, any symptomatic signs. And when we respond on scene, our officers are going to be wearing PPE, and we would ask if there's going to be direct contact. If you have PPE or some type of mask at home, whenever you come out and greet the officers, if you would don that equipment, we would really appreciate that. The other thing is our front lobby is closed at this point. If anybody needs to access or obtain offense reports, accident reports, our accident reports are available online. Offense reports are available through our records division, which is operating daily with a skeleton staff, but you can contact our records via telephone or the internet, and we'll arrange to have a report sent to you either via an email or mail. We would ask that you just not show up at the police department. If you have a need, you can call and make an appointment with the detective division or even the records division, but we just ask you to call and make an appointment. Obviously, if you do have an emergency situation, you can show up at the front lobby and it'll be handled as any other emergency situation would be handled. But please, if you don't have an emergency, try to avoid just showing up. If you'll call and make an appointment, or like I said, make arrangements to get your reports online or via mail, we'd deeply appreciate that. Thank you, sir.
Chief, I know we're all aware that there's a lot of scams going on now that has surfaced to try, on the part of a very small number of our population, to take advantage of people and the stimulus money they may be given. Any suggestions what the general populace should do if they suspect there's a scam that's being?
Yes, sir. They can call our non-emergency number, which is 741-8605, and report anything suspicious. Just remember, no government agency, the IRS, or even unemployment, and anybody calls you in reference to those benefits and starts asking you for personal information such as social security number or a federal identification number or something like that, don't disseminate any information like that. And if you suspect that it's a fraud, you can call and report it to us and we'll investigate it.
Good, good, good. In closing, I'd just like to say it's just imperative that we stay the course and make certain that we make our decisions based on science and medical experts and do what has been suggested. If we're to come out of this, and we will come out of it, we need to all do our part. So I thank all of you for what you have done to help us stop the spread and complying with the testing requirements and so on. But I urge you to continue to do so. This crisis is going to be with us for some time to come. And as I mentioned earlier, there's going to be a new normal after this. People are probably going to be more reluctant to shake hands and do social gathering, and people try to get back to work and get the bills paid that they didn't have the resources to do before. It's just going to be challenging to many of our people. So I thank all of you for recognizing the importance, the role that you play, and I know that you will continue to support what we each must do if we're going to get the proper response to this crisis with minimum further loss of lives and the tremendous impact on our economy. And we'll update you next week. Thank you.